Hey, how's it going, guys? This is Mark Lopez with New Tampa Fit Body Bootcamp and NewTampaTrainer.com. I'm here with Dr. Scheu with New Tampa Chiropractic. How are you doing?
Good, man. How you doing?
Doing excellent. So yeah, we're here, and basically I want to get a chiropractic, just talk about the benefits of core exercises. We're all looking to lower our body fat, slim down, flatten our stomachs, and we want to do it in a proper way that doesn't injure our spine, damage the spine in any sort of way. And Dr. Scheu is just the man to talk about that. So Dr. Scheu, I just want to talk about, do you first off, do you recommend any sort of sit-ups or crunches with your own clients in terms of people looking to build stability?
It all depends on the patient's abilities to perform the exercise, obviously. Today's typical patient, usually we try to educate them on the proper way of doing a crunch without injuring their back. Back injuries are one of the most number one things that keep people out of work. Numerous times we've had many people that come in here from the gym straining their back because they did crunches, they did a lot of pull out too hard, lunging, those kind of things. Just putting too much effort in when they shouldn't have to. As you know, technique is everything. So what we do is we take the patient after assessing them and so forth and saying, okay, your acute situation is gone. Now we want to work on core stability, because core stability is obviously, as you know, provides more support to your spine, keeps it from going out as often as it can. So what we do is we have a variety of exercises that we talk about. We have, this is a Bosu ball. Bosu ball can be used flat as such, or we flip it over, depending again on the patient's ability to perform the activity.
Okay.
We have a wobble board, and it's awesome. This thing we can vary it by making it a little bit more difficult by doing this, dropping it back down. Again, this is an exercise involving balance, proprioception, and the thing that's great about these stability balls is that you don't have to target. You know how you say people target obliques and the internal obliques and external obliques and all that? Stability balls target your core.
Okay.
The core is here to here, obviously.
Yeah.
And you don't have to worry about hitting internal crunches or external crunches or doing a certain oblique exercise. You can do it all with a stability ball.
Okay.
Stability ball, as such.
Okay. Let's see some exercise.
Stability ball, just like this.
Yeah.
A lot of people too, measurement-wise, they go by height. If you have someone that's shorter, preferably 5'7" or less, they want to use a 55-centimeter ball.
Okay.
Too big of a ball, they're not going to get the exercise done properly. So myself, yourself, we could use 65 centimeters.
Okay.
Anybody larger than 6'1", 75 centimeters is a little more stability. So we start out like this. One thing that we had the patient do right off the bat, have them bouncing up and down with posture. Head back, shoulders back, stomach tight. What this does is it stimulates the spinal cord, allows it to start to strengthen all the little muscles and fibers along your spine, particularly called a dentate ligament. Dentate ligament is the size of your eyelash. It's what strengthens your spine. So we start with that. Once a patient gets used to that, then we have them go into, obviously, the basic crunch, if you will, but it's not more, it's crunch on a stability ball, so it's different, it's more support. So we have the patient walk out with the ball, lean back when they feel the ball hit the small of their back, lay back. This is where the trust factor comes in. We usually tell the patient hold on the table for training wheels. Training purposes, you want to have a partner there or have somebody there holding on to your hands the first time they use it, because they can't fall and obviously injure themselves and make it worse.
Yeah.
Okay? Which you consider me if you happens. Alright. You want to start out like this, almost like a plank type position. One of the biggest things that people do is they start out, they're too low. You don't want them starting like that. You want them in a plank position because, again, you're teaching them how to tighten up the core. This, you can't really tighten up the core as much.
Okay. From this way.
So, there you go. So as we start, hands, one of the other things that patients do is they put their hands behind their head and they pull up. Obviously, we don't want them to do that because they can injure their neck as well as cause more pain to their lower back. So I have the patient start here, or just keep your hands at the side. And the thing that's great about the stability ball is people can use it to their advantage. They don't realize that. If you use it to your advantage, you can make the exercise easier. So what you do is you actually push off with your legs and come up. And then you come back down. Nice and easy. And one of the biggest things that people want to do is they want to come back down to here, again, to that plank type position. Push off with your legs and then come back up. And back down. Push up. And you can see I'm shaking a little bit. That's pure abdominal muscle working. You're isolating those abs. You're isolating your core perfectly. We had the patient start out with 10 reps. If they have no pain, increase it to a second set of 10 reps. If no pain, 3 sets of 10 reps. If they have no problems with doing 3 sets of 10 reps, then we up the reps, obviously, to 15, 20. That's one form of the exercise, obviously. Then we have a plank, which you know what, it'll be easier. I can actually demonstrate on you as a matter of fact.
Okay.
You can go ahead and line your back here. Just put your head down this way.
Down.
Yep.
That, okay.
Just like that. We're going to use a smaller ball. And put your legs up for me.
Okay.
This is a plank with a ball. Plank with a ball, excellent exercise for the core, for the lower back, for your abs. What you're going to do is you will have your hands flat on the table, preferably done on the floor, but for demonstration purposes on the table. And what you will do is you will plank up, and it's a bridge. And as you're doing that, you're contracting your glutes, you're contracting your abdominal muscles. Core, stabilizing SI joint right there. Let it down. You hold each position for about 5 seconds, 10 seconds. You pop back up again. Again, great exercise because you're knocking out 2 birds with 1 stone. Rectus abdominis muscles, erector spinalis muscles. Great exercise. And then you can make it difficult. You can raise up, and you're pretty fit. You can try to raise the leg off the ball. You can feel that isolation again even harder. Put it back down, drop down. Obviously alternate. You can raise an arm. You can do whatever you want to do. Great exercise for the core. All right?
Awesome.
Come on up. One of the other things we talked about earlier, the wobble board. Basically, this is an exercise designed to just teach balance and posture. And a lot of people walk around with this kind of posture. I call it the turtle posture. You just kind of look around the traffic left and right. Your head goes out. So we step on this board. And what the idea is to be able to go in a nice, easy manner, the clock. In other words, from 12 to 6. And what you're doing is you're learning how to shift your weight, but you're keeping your posture. So you go 12 to 6, you go 3 to 9, without rolling it. A lot of people, they go this way. They roll it. We just want to go 3 to 9. You're learning how to walk now with your posture. And then we go all the way around the clock. What we're doing here is pure posture pelvic type exercises. Strengthening, contracting muscles at the same time, having to go this way, having to go the other way, teaches them coordination. And that's, pretty much stability-wise. Boosted ball, again, pretty much the same thing here, get a little bit more advantage with it. There's some other exercises that we do. Cross-crawl exercise, where you're on your hands and knees, laying out, like such. You can do it again on the ball, when they're sitting on the ball. Have them raise an arm up and raise a leg up. Again, it teaches posture, it teaches balance, which is the biggest thing right through here.
Okay.
So, that's pretty much what we do.
Awesome. That's great. That's short. So if anyone has any questions on any chiropractic services or anything you offer, what's the number that they can best reach?
They can call us at 813-994-6111. You can send me an email, Dr. William Scheu, Dr. William, SCHEU at AOL.com. And we'll be glad to help you out.
Awesome.
All right.
Appreciate that, Scheu.
Thanks a lot.
All right. This is Mark Lopez, a New Tampa trainer, New Tampa Fit Body Bootcamp. We're here with Dr. Scheu at the New Tampa Chiropractic. This is located in the Target Marshalls, correct? Is over here?
Super Target Plaza.
Super Target area right off County Line Road in Bruceby Downs. Go take a look, guys. Thank you again, Dr. Scheu. I appreciate it.
Absolutely.
All right,
Thank
guys.
you.
Have a good one.